Hello friends, I'm Christine with a K, and today I'm going to talk about going to doctor's appointments with our loved ones. They may ask you to go with them, or you might ask them if you can tag along. Either way, it's a huge change for your loved one. Something they had done on their own without issue before, they're now accepting it would be helpful to have another set of ears in the appointment with them. My mom was in the hospital in 2018 and afterwards had a lot of follow-up appointments. And that was when I started taking charge in a way of her health care. My dad could have done it, but I think he was more comfortable if I did it. I of course kept him informed and would ask his opinion as well as my sister's on decisions that had to be made. My dad has Parkinson's disease and gets his treatment at the VA hospital in Philadelphia. A few years ago I asked Dad if I could tag along to one of his appointments. One, I wanted to see the VA hospital for myself and see what kind of care he was receiving. The VA had been in the news over the years quite a bit for poor treatment of its patients. And side note, that facility in Philly is absolutely amazing, and his medical team in the Parkinson's clinic is top notch. Secondly, Mom had always gone with him, and she was no longer reliable in terms of remembering information and certainly understanding it. So I went with him back then, and I've been going with him ever since. When you start attending any medical appointments with your loved one, a HIPAA form will need to be filled out. Your loved one will have to sign it and say that it's okay for you to be in the appointment with them and that the doctor can speak directly to you about their health care. You will need to sign it as well and give your contact information. By filling out this form, you can call the office and get test results instead of waiting for another appointment. You can call and ask questions about your loved one's condition, and the doctors can freely talk to you about it. I cannot stress this enough. You have to sign this form every single calendar year, or the doctor won't talk to you. Also, doctors ask for emergency contact information. If something happens during an appointment, they need to know who to call, especially if you're not with your loved one. They usually ask for 2 to 3 names. Make sure you're listed as an emergency contact, and at least one other person you trust who would show up if needed is listed as well. Bring your notebook or a pen or a pencil. One thing you need to add to your healthcare team page is the physician's assistant and/or nurse who works with your loved one's doctor. Chances are, if you call to ask a question, it's the PA or nurse who will call back. They are invaluable names to have. Your notebook. Good doctors will appreciate that you are taking notes. You can also put in that book questions you want to ask the doctor on your next appointment. Last year, my husband had a freak accident where he fell and ended up with multiple compound fractures of his left forearm. He required 2 surgeries in less than 7 days. I was using a bullet journal at the time, and so I just started a page to keep track of all the different medications that doctors had put him on. I wrote down what the drugs were, when he took them, how frequently he was allowed to take them, and to the point where I was writing specific times next to the drug every time he took it, so that I didn't give like a pain medicine sooner than he was allowed to have. At one of our follow-up appointments, I pulled out my book and the surgeon saw it. I told him what I was tracking, and he stood up and came over to me to see for himself what I had written down. And he loved it, and it was helpful for him in treating my husband. It doesn't have to be pretty, it just do what works for you. When you go to appointments with your loved one, and you notice that they are maybe starting to forget things, you want to make sure that they have their insurance card in their wallet, their purse, etc. And if you notice that they're starting to forget that more, see if you can take the card and make a copy of it, or take a picture of it and have the picture of the card in your phone. And depending on your loved one's health, you may feel like you need more support in caring for them. Ask the office if they have social workers that they work with. If so, get the contact information and reach out. They can give emotional support, give you ideas of support groups and community government agencies that can help your loved one. We'll talk more about that in another video. Doctors appreciate families who show up with their patients. I can't tell you the number of times my mom's neurologist and primary care doctor said how lucky that mom was that her daughters were there to support her. The neurologist says he has patients with Alzheimer's and they have no family support whatsoever. I can't even imagine. Is it easy taking on a bigger role in your parents' day-to-day life? No. It can be time-consuming, emotionally draining, and slightly anxiety-inducing, but I wouldn't trade one moment of that over the last 4 years. It was an honor and a privilege to do what I could for Mom. She appreciated it. My sister and I couldn't imagine walking away from her or Dad. I'm going off on a bit of a tangent here, so maybe that'll be another video too. Ask permission to go to appointments with your loved one. Make sure they have their insurance cards. Take your notebook and pen. Fill out the HIPAA form and make sure the staff knows that you are your parent's child. Be present, take notes, be supportive, ask questions. You can do this. Till next time, TTFN, ta-ta for now.